All right, good evening, everybody. My name is Jose Manatu, and I'm an associate professor at the School of Pharmacy of the University of Connecticut. And I train as a biochemical toxicologist, looking at chemical and drug-induced target organ toxicity. And most of my work deals with acetaminophen hepatotoxicity, and about the last 5 years or so, we have concentrated at looking at the role and function of transporters in liver, and the role that transporters they play in dictating susceptibility to chemicals and drugs that they have hepatotoxicity liability. So what I'm going to do today is to switch gears a little bit more and to talk about models of drug-induced hepatotoxicity due to inhibition of bile acid elimination, biliary excretion rather of bile acids by inhibiting BSEP, which is known as the bile salt efflux transport protein. Okay? So to give you a kind of an orientation about these transporters, I think some of this information is familiar to some of you. But basically, we have here two adjacent hepatocytes. The junction between these hepatocytes, it's what is called the bile canaliculus, and when you have the cells that are close to each other, they become polarized, and that establishes the vectorial transport of chemicals, where you have uptake of chemicals from the blood inside of the hepatocytes, and there's an array of transporters that are present in the lateral side of the hepatocytes for the uptake of chemicals into blood. We're going to talk about NTCP, which stands for sodium taurocolate transporter polypeptide. This is the main protein involved in the uptake of bile acids inside of hepatocytes. Also, we know that some of these organic anion transporter polypeptides, some of them will have affinity for some forms of bile acids, so they'll also have a role in the uptake of bile acids. And then what happens is that some of the bile acids can actually undergo conjugation with different amino acids, or they can also be excreted out of the cells in their unconjugated form. And then what we see is that the excretion is mostly biliary. You know that bile acids are mostly excreted into the bile. And BSEP is actually the main contributor to bile acid secretion in hepatocytes. What we know is that not only BSEP transports bile acids, but BSEP also have affinity for a number of chemicals. Some of these chemicals, they happen to be pharmaceuticals, and what we see is that some cases of drug-induced hepatotoxicity is because this ability of these chemicals to antagonize and compete for transport by BSEP. Okay? So that results in accumulation of bile acids in the presence of this pharmaceutical through a competition type event going on. And the combined effect of the hydrophobicity as well as the detergent action of bile acids is what can actually produce damage to the hepatocyte. It starts with oxidative stress, and the more bile acids accumulate, that basically progresses into what we call a cholestatic type liver injury, meaning that there's a reduction of bile flow, accumulation of bile acids, and because of the detergent effect, you have damage to these hepatocytes. Okay? So there's a number of factors and conditions that are known. So what happens, if I can go back, when these bile acids accumulate, there's many signaling pathways that are activated within the hepatocyte, and you have some compensatory responses that are placed in motion to try to deal with this overload of bile acids that are present in the hepatocytes. And one way to deal with this is by regulating enzymes involved in bile acid synthesis, and also to regulate backup exit doorways for these bile acids, so that they, instead of going into the bile, they can be secreted back into the blood. And that's basically